Guys, have another article coming at you. We've been going on this theme of how sometimes things are overdiagnosed and overdetected, and there's a great article that came around a while back that I really want to touch on because I've been handing it out to any of my patients or anybody who wants to listen to it or read it. And it's called Muskuloskeletal Healthcare: Have We Overegged the Pudding? Really interesting article, really interesting title for the article, but if you get into it and read it, and I highly recommend that you read this article if you have the time. They're trying to talk about in the medical community how we overdetect things, we overdiagnose things, and all that ends up happening is the patient ends up going through a lot more than they need to for a certain diagnosis or for certain issues that are going on with their body, and we end up spending a lot more money in the healthcare field than really is required to help something heal. And a lot of times overdetecting, overdiagnosing does much more harm psychologically and musculoskeletally to the person than needs to be done. Overdiagnosis is an unwarranted diagnosis that leads to unnecessary treatments that do not benefit the patient and that waste health resources that could be better used elsewhere. Overdiagnosis also may cause harm such as direct effects, unintended/indirect consequences, psychological impact, cost, resource, things like that. They talk a lot about this. The irony here is that even though the clinicians were acting in good faith and aiming to help the patients, they may have harmed them through overdiagnosis. What compounds the problem is that many of the surgeries that are encouraged, like a knee scope, we've talked about knee scopes, or subacromial decompression surgery, are now known to be no more effective than placebo. In all these cases, the medical overuse is triggered by an unwarranted diagnosis. Over definition, they use the example of some in the back pain field dismiss the label non-specific low back pain and instead argue that labels targeting a specific structure like a disc, a facet joint, or mechanisms like instability, and the use of similarly targeted personalized therapies. The problem is that the diagnosis offered are nominal diagnoses. These diagnoses drive more invasive, costly, and ineffective therapies without providing any benefit. The resulting overuse is substantial. For example, the most expensive surgical procedure in the USA is a spine fusion, a procedure that is most commonly performed for degenerative conditions, for which there is a good evidence of harm and poor evidence of benefit over cheaper and safer alternatives. They also go on to say that a lot of times some of these things are clinician driven, meaning that they're money driven, and a lot of it comes down to the fact that many clinicians, I believe, are, and this study states, are unaware of the research, and not only are they unaware of the research, but they keep promoting fads and things that just haven't been shown to not be beneficial, which increase the cost and end up wasting patient time and maybe could be playing some major psychological roles in what the patient believes to be their issue. So we don't want to do that. We want to tell them what we know, but keep it in a sense to where we're working towards something and not simply focusing on the issue. So give this a read. It's really interesting, and share it to whoever you think would like to read it as well. Have a good day.